Thank you. That was so powerful from Navid, who I've also known very closely. She's really turned her story into a very powerful tool, to reach out to other people. But, I think we are so honored that we can still continue this session with Her Royal Highness Princess Dina Mired, who is here, who has been a big advocate for patients. And so we'd like to welcome her to the stage. Please, let's clap for her. And then also even more powerful, we were able to still get Dr. Mareya Almarzouqi, who by herself is actually a doctor who is now also a patient survivor for cancer. So we'd like to welcome her to the podium as well. Give her a hand, please. So yeah, we're going to start with a very simple question for both of them. And I'm sure you all can identify the fact that when you hear the word cancer, that often means loss, it means fear. In Africa, I'm sure Excellency Zainab can attest to this, that when you hear cancer, it's actually a death sentence. People hear that. That's what it means. So Princess Dina, Dr. Mareya, when you hear cancer, what do you think and why?
Yes, thank you. When our son Rakan was diagnosed with ALL leukemia in 1997, immediately a rumor went out and they said, oh, well, she's young, she can have another child. That was in 1997. And thankfully now, when one has cancer, that was then, the stigma was so, palpable that people didn't want to talk about it, and immediately they assumed that. But now, alhamdulillah, the situation has changed. Yes, cancer is still uncertain, right? You're never 100% sure you're going to conquer it, but the cure rates are super high now. Alhamdulillah for that. But that, of course, does not include, like you said, the 70% of the population in low middle income countries who don't get care, right? Because as we speak today, in 2025, a child with ALL leukemia, he or she is supposed to have cure rates of 95%. They will get a measly 10%, and if that, for a cure. But of course, when you hear the word cancer now, given that I've been through it as a carer, even at the best hospital in the world, and with the fantastic support of my family, my husband, everybody, you still worry and concern and fear. There is still that. Cancer journey is tough, and it's certainly not a walk in the park. So one still has that, but there is more hope now for sure, for at least certain diseases that have high cure rate. Thank you.
Thank you so much. Dr. Mareya?
So I would say myself, when I heard the word cancer, I had big faith in science. I have to say that. Yet I had gush of emotions. I felt overwhelmed to the point that I was not able to verbalize it. I had big faith in science. I knew that there is a lot to offer me. I knew that there is good prognosis. But cancer, I think it's not just personal. I think it just shakes the full family. As Princess said, really, the family all around, they feel the shake. It's an earthquake, actually, gush of emotions. Still, though that I come from very educated background, my family doesn't pronounce the word cancer in front of me at all. Still, they would say some other words they would avoid, especially elderly. They would not say it to me directly. So I would say that it's a bit, for me, it was a very confusing moment. I would say when I heard cancer, because part of me had big belief that it's gonna be cured, like there is nothing wrong. I'd go, but yet though that the faith was there, emotions you cannot resist. It just overflowed.
Wow. Yeah. And I'll come back to you, Princess Dina. I mean, just thinking about having had a child with cancer as a mother, how has that changed your perception about leadership and power, and how we should lead in this particular area?
First of all, being a parent or a child with cancer is literally a PhD crash course in leadership in crisis mode. Of course, in the beginning, when we first heard the news, and again, the time was very different. In 1997, no one spoke much about cancer. And at the time, believe it or not, we happened to be, that's when we discovered it. At the time, we happened to be in the UK because my husband had a master's program in Cambridge University, and we as a young family actually accompanied him. I didn't want to study at all. I knew that much. I hated exams. Anyway, and even then, the general GPs did not know about cancer. That was the time we were in. And so when we found out, of course, in the beginning, shock, horror, fear of death, worry, you just, again, you start blaming yourself. What did I eat when I was pregnant? What did I do? Was I nasty to some people? Is this payback time? Whatever that goes to one's mind. And then, of course, as a parent, then you say, snap out of it. Now is the time to take action. You've got a child to help survive and take care of. And it was a time, before Dr. Google. Yes, no internet, no nothing. And that was also very challenging. And it was the time when the National Health Service in England was very paternalistic at that time. You couldn't really ask questions. You couldn't, very measly leaflets would be in the corridors. And I remember, once I got my act together, trying to navigate the system. By the way, the system was very tough in the beginning to actually get in. Why? Because I went so many times to the emergency room and nobody knew anything. Until I called the antenna of a mom. I knew something was wrong, but in no shape or form did I ever think it was leukemia, because in those days, we didn't even think about that. And once we found out, finally we could, then we're taken seriously. But we were delayed for some time because nobody knew until my doctor, I literally wrote the symptoms on a piece of paper. To this day, I keep this paper. And I can't believe I didn't even think it was leukemia, because we just didn't know in those days. So when we went in and started to get to know and to figure out where are we, what's happening, I was even called a difficult mother for simply asking questions extra, taking some time from the doctors, because in those days, I'm sure it's changed now, doctors knew best and the NHS is free. So that was that, yeah. So I went through the system myself, but I still consider I was of the lucky few to have been in a fantastic hospital, Addenbrooke's at the time. And at the time, that was how cancer care was everywhere. And then later on, for bone marrow transplant, because I thought we should be in the best place just in case there would be a bone marrow transplant that he would relapse. And surely he did. So we ended up going to a children's hospital like your nephew and Dana-Farber Cancer Institute. And I remember navigating that system as well. So when we finished treatment, and it was tough by any measure. I always say, having not worrying about the financials, having an amazing family support, friends, family, you name it. I cannot imagine poverty and cancer. I just cannot. It's just catastrophe. So when we went back to Jordan, eventually, I knew that it cannot be, when you go through such an experience, it cannot be that other parents who love their children just as much do not even have the chance for any treatment, whether it works or not, to have the rightful chance for a treatment. I knew I had to enter the Mareya and try to help with the team in Jordan to shake things up and to make it happen.
Yeah, and it's just amazing how you've turned, that into leadership, really inspiring the world. I mean, I don't even know if you know the impact of how that, you've inspired other people to be able to deal with this situation. So thank you, truly, thank you. Dr. Mareya, yes, you've often sat on the side where you're the doctor. And now, you are on the other side. How has that changed? What has surprised you about this? And how is there anything that you can share from that perspective?
So I have actually played two roles clinically. I would use these two roles. So as a physician, and the second, I'm actually working globally as well. I'm a philanthropy professional for health initiatives broadly, including oncology, where I was involved in visiting 12 countries, African, Asian, Middle East. We had projects as well, similar to the ones that AMSTRO is now advocating for. So when I became the patient, as I said, I had big faith in science. I had big faith that I have accessibility to the care, and I had choices. And that I saw with my own eyes, and I recall that was not available at all in the countries that I visited. I went to Mauritania, and there was a lady I can't forget. She was covered up because obviously she looked culturally, religiously, that her background, that's why she's covered up. But she opened up her breast in front of everyone to show them actually it was disfiguring. The nipple was disfiguring in front of everyone. She was trying to seek help. And that hospital in particular did not have any kind of oncology service at all. And I don't think around as well. So that, for me, that I had the accessibility, the faith that I have the care to seek, immediately I remember the people around, those who don't have. So I had my purpose back then when I go back to my work on how we can do this much better. But when it comes to personal level, let me tell you this, I hope no one of you is upset, because I'm going to be very frank. Medicine has lost its humanity touch. I did not feel that at all. Surgeon told me that I have a beautiful scar. That's painful. A physician told me just relax. And I was just diagnosed 2 weeks ago with cancer. It really hurts. When someone tells you just relax, you feel dismissed, you feel devalued, dehumanized as well. At that time, I felt I was being difficult, Princess. When you felt that you were a difficult mom, I felt I was being difficult. I reminded myself how much there is accessibility to care. And I should be grateful. But deep inside, there was sadness, there was guilt, there was grief. I was told also that whenever I was complaining of a side effect, I was told that it's normal. No one should hear this, even though if us as a doctor, we know that this is expected. I don't think that's good to say to patients, honestly. It hurts when they hear that this is normal, it's expected, it might be more. I needed someone to look me into the eye and to touch my hand and just be in silence. Honestly, I don't feel that I needed someone to give me solutions. Take this, use this, do this. They did not listen. I felt that medicine has lost its humanity touch. I think what made me feel this, it's not the cancer itself. I'm a survivor of car accident when I was a child. I was a witness of a mother became paraplegic from that accident when I was 7 years old. So she survived 30 years, but with no quality of life. I don't know what's the importance of just surviving, honestly. I wanted quality. There was a lot of emotional, like, I don't know what to call it, bomb inside. No one gave the space and held for me the space just to stay there and look into my eyes and just we can be human for a moment, from a human to human. I think this is what was the most prominent thing for me.
Wow, that's so powerful. Let's thank her. Thank you. Thank you, Mareya. Yeah, and that you are now taking that globally. It's really phenomenal. Yeah. I know we don't have so much time, but I would like to ask you both one more question. We are here at a really historic event when we're launching AMSTRO. And I wonder, what do you have to say to the doctors and the oncologists who are here, the health professionals, the physicists, the radiation oncologists, when they walk into the clinic tomorrow, and they see a cancer patient? Is there anything that you would like to share that they should have in mind?
I think our lovely young doctor said it best. Listen. And I know doctors are busy and they have difficult timetables and timing is of the essence. But I think there has to be, like you said, a new way of, at different times, I'm not saying all the time, to actually listen and communicate in a way that's going to give vitamin hope, vitamin love to the patient, to actually time to absorb what happened to them. And I think exactly what you said, sometimes the hospitals have their programs and their timings and their I don't know what. So it's also hard on the other side. But why not, expect a little bit something better for cancer patients? And if I am to remember something during my time as a mother of a cancer survivor, one thing is the waiting for everything, waiting for the blood tests, waiting for the results, waiting for the appointment, waiting. And I remember meeting somebody from Australia who said, this is the only industry where even if you are paying, for the service, you're not expected to have a good customer experience. We're just supposed to just take it. This is how it is, even if you pay for it. Why not dream of something a little bit better so that cancer patients, whose time is actually very precious, to say the least, we can do better. Why not think of something else? But I want to thank you for actually, this is the first conference where I see patient voice is being showcased on the first day of the conference, not as a side event. On the first day of the conference, having a keynote spotlight. And this should happen all the time. And for those radiotherapists who are listening right now, at least from what I heard from you, is, maybe sometimes do a questionnaire or survey. How can you serve the patient better? Those who are feeling a little bit low on that day, what words would they want to hear? How can you explain symptoms, maybe still truthfully, but slightly better? Maybe.
Thank you. Thank you. You know what? We hear nowadays that artificial intelligence patients will come into the clinic now with their AI in their pockets to listen and talk to the doctors and assist, you know, but so powerful. So we can actually learn from that we need to listen. Is there something you want to add to that, Dr. Mareya, before? Yeah.
I think I would just say that one thing, accessibility to knowledge is not going to be an issue now on. It's going to be, we're going to have a lot of accessibility to knowledge, but I mean, keeping that human touch. I think whenever the provider can connect with himself as a human being, they can connect with another human being. Yes.
So well said. So well said. And with that, ladies and gentlemen, please let's appreciate what they have. Let's thank them again one more time. Thank you so much. All right. With that,